Um, the Refugee Law Project is a project of the School of Law, Makerere University. And we work with forced migrants, and we are the Center of Justice, really. We call ourselves the Center of Justice. Our programs are delivered in 5 thematic areas. The very first one is access to justice. And then we have gender and sexuality. We have conflict, transitional justice and governance. And then we have mental health. And then we have media for social change, where I sit. So when you talk about specific uh, programs for North Sudanese, I would say they all access all our services. I would say um, the thing about them, probably what we've realized, is that they're very highly they're very professional. They have a professional component, like that we've had to start working on. For example, many of them are doctors, engineers, and they're seeking to see if their services can be useful here as they wait to probably go back home. Okay, so one of the things that we've been doing is to work with professional bodies to see if they can get if they can be allowed to practice while here. Um, Majorly that, but I think for the other services like mental health, English for adults, all those other services, they actually um, they access them like any other refugee that is around, because they have very similar challenges. If you get yourself here as a refugee, you're likely to have very similar challenges. You're likely to be facing, say, mental health challenges, or distress and all that. So it's the same kind of services that they um, access, just like the rest of the refugees. So as refugees, I'm sure they told you their challenges, but they would definitely face issues of, say, access to justice. Uh, they are likely to face issues of livelihoods, because when you come in here, you find the hosts are also looking for jobs, then you're also looking for jobs. That's going to be stressful. And then you find they are having health concerns, because some of them probably got injured on their way here, or they're probably just going through some health challenges that need to be addressed. They have issues to do with education. If you find some of them, they've left school, well, probably they were in university and they come here and they need to be able to access university. Our systems are not very easy to access when it comes to accessing university, because you need to have papers, and probably you took off from home without actually the papers. So how do you rejoin university? Those are some of the challenges that they go through. Yeah. But when you say how, I don't know what you exactly want me to say. But we have an access to justice program, and it does quite a number of things. One of the most important things that they do is what they call the English for Adults program. Many of the refugees that come into this country do not speak English. And so when they come here, they need to first of all get to learn English, so that they are able to find their way, they're able to go to hospital, they can respond to, say, police concerns when they come in contact with, say, the law. And some of the laws that are in their countries may be in conflict with, say, the laws in this country. For example, if you're coming from South Sudan, where probably defilement is not a key issue, and you come to Uganda and the law says anything below 18, that would be defilement. So the team actually always goes around to do awareness creation to make sure that they they enlighten them on what the laws here look like, so that they do not get into problems with the law. But when we talk about English for adults, I think one of the things I must mention is that they have a curriculum that is called speaking. Is it Speak Your Rights? Hmm? Because it's fashioned in a way that they are actually protecting their rights. Okay, uh, protecting their rights in such a way that you can actually be able to say, "This is me. I am doing this here," and all that. You can find your way really. So that's really part of say accessing uh, how they access say issues around access to justice. When it comes to mental health, there is so much that goes on in mental health. People come and they're distressed, they're probably having personal concerns. And the thing about our services is that they're so interlinked. So someone might come in through access to justice, but then they realize that actually they need some mental health support, so they can be referred to the mental health team. If they come in through mental health and they realize, okay, this person also has a gender and sexuality issue, maybe they have a health concern, then they are referred to gender and sexuality. So it's not like standalone things. You can you can crisscross and get whatever service